We specifically targeted those offenders with long and serious criminal histories, multiple treatment needs, and a demonstrated inability to successfully complete supervision in the community. From the beginning, our initiative has sought to make Knoxville a safe place to live.
Effective. The Knoxville Public Safety Collaborative strives to do just that. We have done this by listening to our citizens, being inclusive, using existing resources in new ways, and being proactive, and by adopting a restorative rather than a strictly punitive philosophy. We'd be happy to take your questions.
Thank you. Doran.
I'm not sure I understand the measures for success in this program. Crudely put, is a good measure of success getting guys off the streets and back into jail before they do something harmful, or is it to reduce recidivism?
It was both. We struggled with that initially up first on. We wanted to know if it would be a success if we intervened quickly when an offender was actually going off the beaten path. And we felt that, yes, that is a success. Although from my standpoint, as a parole and probation agency, that's counted against us as far as recidivism is concerned. But recidivism, we did have a huge impact on recidivism. The control group that we compared to by the University of Tennessee study as compared to the participants in this program, there was a 37% difference in the recidivism rate. And these are the highest risk offenders that we deal with. That's almost unheard of in our business.
Bill Klinger.
I understand that there's some tension between the county and the city in this area, and I wondered to what extent that tension has affected the effectiveness of the program.
I don't think it's affected it to the degree when you look at what's being done from an overall approach. Many of the offenders gravitate and typically live inside the corporate limits of the city. But even those that go outside, we track them as well through other means of cooperation with county officials.
Kathleen.
You know, I think you said at one point that the citizens wanted you to do a better job with the offenders. How was that manifested? Did you have hearings? Was there a survey, a poll?
Well,
or did you just figure, I'd love to hear how?
Part of our overall community policing strategy back in the late 80s and early 90s included conducting a series of crime control meetings throughout the city. We had as many as 300 and 400 participants at some of the meetings, and we went through a nominal group process, identifying problems, what they felt like were needs, and some of the solutions, many of them falling within criminal justice, but many of them falling outside the traditional criminal justice field. It was clearly mentioned to us at repeated meetings, particularly where the violent crime took place, that we as the government agencies and nonprofit organizations need to do our jobs, need to do our jobs better, and that means controlling the behavior of individuals that are being released. The one thing we made real clear to the community groups is that the offender population would come back into the community, as Jim has mentioned, and with our advanced mapping and spatial analysis ability, we can show the community they're going to be back, and here's where they're going to live. This, in fact, is where they're living. And the spinoff benefits have been tremendous. We have a much more informed community now in traditional communities that don't have a great deal of capacity or skill level to make decisions to help make their community safer.
That's really impressive. It's impressive what you talked about with restorative justice, and that's your goal. That's was good to hear.
David Osborne.
Your application says that in discussing the results that the evaluation showed that increased supervision brought about earlier notice of violations and more jail time as a result. What kinds of violations are people being sent back to jail for?
A large part of those were technical violations, where we would have, for example, positive drug screens, repeated positive drug screens. Absconding was a part of it as well, but we also had reoccurrence of criminal behavior. So we felt on the beginning of the collaborative to make the city of Knoxville safer, we had to look at both of those issues, even though for us, as I mentioned earlier, it was a negative for us because it had an impact on our recidivism rates. But we felt we simply had to intervene when it was appropriate, and that was the approach that we took. We tried to intervene when it was appropriate to take the offender off the street after repeated efforts if it was obvious that the offender was not going to comply with the conditions of supervision and became a threat to the public.
So let me understand this from the point of view of the parolee who comes out. What is, and let's say this is a male, how is his life different in this new system?
His life is different from the standpoint that the traditional approach, we would have done no preparation for that offender's release. He would have come in and met with a parole officer. There would have been an assessment tool that would have been completed, and then that offender would have then been under the direction of that officer for just a referral to an agency, put on a waiting list. That's what happened with this first offender. He was on a waiting list for a long period of time trying to get services. He was unable to get those services, and on the 25th day committed this heinous crime. Under the new system and the new collaborative effort, there's preparatory work that happens prior to the offender being released. We meet as a multidisciplinary team. We staff those cases across those agency boundaries with social services at the table, the police department at the table, probation and parole at the table, all the multiple partners at the table. We look at that offender's potential for release and what those risks are and what that risk is going to be in the community. And then we go about team supervision efforts with that offender. And that offender's services are streamlined. There are no waiting periods generally because we set those up in advance, and that helps us. And just like the second offender, the first day he saw a physician and he had psychotropic medication needs.
So from the parolee's point of view, when you come out, you get services, you get mental health services in particular at a much faster rate. You also get slapped back in a lot faster because people are keeping a close eye on you.
Right, exactly. If you're going to commit new crimes, there was a message that was sent there as well. If you are back into committing new crimes, then there will be a quick response on this in this program.
So, but from their point of view, then you're watching them a lot more closely and you're paying a lot more attention to them, right? There's a much more attentive program that's going to ensure they get better services, but you're being tougher on them when they go over the line.
The message was simply this, that our officers tried to convey to the offenders when they were released was, you've got an opportunity now here, a real opportunity to change your life. We're going to hold you accountable for your actions, but we're also going to make sure that you get the basic needs and the treatment that you really need to change your life. And this is a real opportunity for you to do so. And we're here willing to help you, but we're going to hold you accountable.
Yeah, I think one of the things you have to look at when you look at similar programs conceptually in collaboration is you have to ask yourself a question, are there true partnerships? And true partnerships can be, I guess a litmus test would be that we share resources. We have mapping capabilities, database systems that they're not defined just for law enforcement. They're shared with the social service agencies, probation, parole. And from the parolee standpoint, it's not a gloom and doom prediction. I can see a significant difference now in the inmate's potential because in my previous 30 years, before this program started, I never once saw a law enforcement officer go to a hearing and ask for parolee be given a second chance because he or she knew that parolee, was working with that parolee, and they hit a bump in the road. Traditionally, that person would have gone back. Now we see a lot of these individuals that have bumps in the road that a law enforcement officer or someone else in that collaborative effort steps up and says, we can still fix this. And I think the litmus test is that's what separates us from some of the other initiatives that have some conceptual similarities.
Carl.
I'm going to ask you the same question I asked the director of the Division of Parole in New York, which is, at its core, would you see this as a program of where your primary mission is rehabilitation, or where your primary mission is monitoring the activities of the parolee or probationer?
Well, not to hedge on you, but I believe it is both. And I think that's why we've emphasized in our presentation today that it has to be a balance between the two. You're going to get a much better result if you balance those. Rehabilitation, giving the offender the opportunity and making every effort to see that happens, as well as an accountability piece that says that the public demands and says we don't want these offenders out here creating havoc in our community and causing harm to the general public. So there's an accountability piece there, but there's also a very, very strong rehabilitation piece there.
Susan.
Very well publicized case that you indicated when you first started to speak to us had not happened. Do you believe this model would have happened?
I do believe it
Which
would.
I know is speculation, but
Right.
I'm
I
still
do believe
curious.
that we were already involved at that point in time prior to that, and that case happened in 1995 or 96, and we were already involved in other projects in partnership and forming partnerships. So I think it would have evolved. That was a catalyst, I think, to help us bring the service providers to the table, which gives us, I think, the unique perspective that we have in this collaboration, is that they're full partners. We courted them for about 6 months in a series of community meetings to bring those service providers there. We surveyed the offenders and said, look at the number of offenders that you're already working with. And about 64% of the offenders that they surveyed, they were already dealing with those.
Did they resist being part of it?
They did not really resist, but I don't think there was a genuine interest and a genuine concern that would really help and improve public safety. And if they had a real part of public safety, they were isolated. We provided services, so to speak.
Oh, I see.
But it really brought, the light bulb finally went on, and they came to the table willingly and participates, and they're full partners.
Elizabeth Short.
Given the great interest around the country in reentry issues, I assume you're getting a lot of interest from other places, and I was wondering what elements of your program have aroused the most interest, and are there elements that you think are going to be very hard to replicate and that won't travel easily?
We are replicating this program across the state of Tennessee already, and we have be replicated almost in any jurisdiction. It may take redirecting of resources. It may take getting all the partners and all the players to buy in and getting them to the table. But it can be done, and it is being done in the state of Tennessee, and it is being done in other jurisdictions across the country that have contacted us for help.
And those are the core issues?
Exactly. What we found, and what I found as the director, is what worked really well for us in Knoxville may not and has not worked specifically as well in Memphis, and the same thing for Nashville. But the core elements of the partnership and the collaboration are there, and those core elements are the things that I think are going to continue to make us successful.
Susan Golding, last question.
Last question. When you went to Memphis and some of the other, out of Knoxville, what was the primary motivator of that interest? Public safety or something else?
I think it was public safety. I believe it was.
And as part of that, if you reduce the recidivism rate, you're obviously saving the state a great deal of money, but not necessarily some of the other groups are saving. I mean, Nancy, has there been a recognition across the board that even if the money is saved in one agency but not the other, that it's still a good thing?
Yeah, I think
from
so.
other
I think
agencies,
one
because I know
example,
I've found resistance in the past because of that.
It saved us money in law enforcement, and I've testified on Jim's behalf at the state level in legislative sessions supporting his budget, as well as the same would be true in nonprofits and appearing before allocation groups that dole out